I'm Ayden Battin, upcoming senior, super excited. I'm a kinesiology undergraduate major, looking to go into exercise science in the future, publish my own research.
My name is Kelden Fuachie. I'm from Ghana and I'm a rising sophomore. I'm looking to major in computer science and probably do something with machine learning or either software development.
So I'm Dr. Reuben Addison and I teach biomechanics, motor control, and sports psychology. I also teach sports analytics, and I'm a researcher too.
I mean, coming to DePauw, I didn't think I'll be doing research, but when the opportunity came up, I think so far it's been a fantastic experience. From what you're working on technically to even just social connections. These guys, Dr. Reuben and Ayden, just in general conversations, have even opened my perspective into what's available, just how every field is interconnected and what we can do to help.
So in the beginning of the spring semester, I started scouting for students, and it was important to me that these students were actually interested in this research before I bring them on board.
We really wanted to focus on the individuals who have limited access to healthcare or generally poor health-seeking behavior. So imagine going to any healthcare provider or outlet and just giving them BMI, age, or just basic information, and that clinician or doctor or medical personnel being able to predict hypertension. We felt that using that data set can help clinicians or just medical personnel in general to make healthcare more accessible.
It's a model building framework that we want to do to ensure we're actually helping population who have poor health-seeking behaviors and also may have limited access to healthcare access. So we can actually do something good with our skills when we combine.
We want to add to this data pool that can help others, and I'm proud of that because the fact I know we can make change in society, and with further data, we may be able to help rehabilitation.
I had kind of, like from late high school years to early college, I had kind of shut down the possibility of doing anything medical or anything with biology, but this has also kind of opened that side up for me, just with conversations with Dr. Reuben and Ayden, who are in kinesiology, and how it also affects us as humans when it comes to rehabilitation and all these things. It has shown me that technology can be used outside of like the context I thought it was for, which was just developing apps, but also the human side of it and how it can contribute to someone's life or someone who doesn't have access to healthcare.
The freedom I've gotten from Reuben and the ability to actually learn how to do research papers, because he's given me free rein to write. It just furthers my want to go far in this and do further research, because I want to meet those people. I want to make those connections. I want to meet the bright minds with different perspectives. I know for a fact that I want to continue this.
So these students will also go beyond your horizon and then hit your blind spots. And that's how great discoveries occur. So if you try to gatekeep or try to micromanage, you're not encouraging growth. So I think that's the plan, right? To encourage, to give that aspect of freedom where students will also come up with brilliant ideas that will help.
I've learned so much this summer, and it has actually even further expanded my thoughts on what I want to do.